So I'm here to share what I know about convulsion, what I've seen, how it has been handled medically. So I'm not trying to dispute what our parents, our mothers know about how to handle convulsion. Some of them are really not necessary. I will talk about those in a bit. So let's talk about what is convulsion. Convulsion is a sudden involuntary relaxation and contraction of the muscles that comes with shaking, twitching, loss of consciousness, and all that. You see a child, I don't know if you have, the video you just watched, you see a child convulsing. That is how a child who is convulsing looks like when they are convulsing. What causes convulsion, you may ask? Well, convulsion can be caused by various factors such as injury to the head, infections like meningitis, stroke, and even drug overdose, drug overuse, drug abuse can cause convulsion. And in children mostly, what causes convulsion in children is mostly fever. High fever that exceeds that 8 degrees can cause your child to convulse. How do you handle convulsion? So what do you do when you see a child who is convulsing? It could be your child, it could be someone else's child. The first thing to do is that you remain calm. Please stay calm. When you are panicking or when you're not calm, or maybe people around you are not calm, you won't be able to know the right decision to take. You might be hasty with your decisions. Number 2, please take the child away from danger. Look around the child. Is there anything around him that could harm him? Is there any sharp objects, things like that? Please take them away from the child. If they cannot be taken away from the child, please remove the child from that danger and place the child in a place that is safer. Number 3, turn the child to their side. It could be their left side, it could be their right side. Lay the child by the side. The reason for this is that to prevent the child from choking and also to clear the airways. And check if the child is wearing a tight clothing. Please loosen the tight clothing. And if you cannot loosen it, or maybe you can remove the clothes, go ahead and remove the clothes. But if you can't remove the clothes, please find a way and tear the clothes. Let the child's airway be free. Let the child be breathing. That is the most important thing. Please, when a child is convulsing, do not put an object in his mouth. Do not put an object in her mouth. We usually have this practice of putting a spoon in the mouth of a child who is convulsing, or even an adult who is convulsing. Please, putting a spoon in the mouth of a child when they are convulsing does not stop the convulsion. Rather, you are exposing to the child to risks such as choking. The child can choke to death, and this object can as well damage the child's teeth. And another risk of putting an object in a child's mouth during convulsion is that it increases the risk of vomiting. And when a child vomits while he's having convulsion, this could lead to aspiration. Yes, can lead to aspiration. So please avoid putting any kind of object in the mouth of a child or an adult who is convulsing. It does not help. So number 6, and this is the most important part of this, please time a child when they are convulsing. Check the time that the convulsion started and the time it ended. This is to help to any complications or prevent any kind of complications that may arise. If the convulsion lasts more than 5 minutes, please take this child to see a doctor immediately. And also, this will help the doctor to determine the treatment plan for this child. Convulsion can be a sign of an underlying sickness. It can also help you to determine, to know when your child is in danger and when to seek for medical help. What are other things that you need to see or notice before you rush your child to the hospital? Number 1, when your child is having a multiple seizure, like when I say multiple seizure, I mean convulsion seizures that stops and starts almost immediately. Please, you need to see a doctor immediately over that child. And also, if your child pass out after convulsion, like if the child is no longer breathing after convulsion, please seek for medical attention immediately. Convulsion has become a medical emergency if it happens more than 5 minutes, and also if it happened multiple times in a row, back to back seizure, and also if the child does not wake up after convulsion, please take the child to a hospital immediately. And also, when the child, if it is the first time of the child convulsing, it has never happened before and this is the first time, please take the child to the hospital for medical attention.